Good evening and welcome to NRAS Live. I'm Clare Jacklin, Chief Exec of the National Rheumatoid Arthritis Society, and I'm delighted to be joined here this evening by Emma Caton, who is going to share with you in a few moments the findings of our stress survey, our Stress Matters survey, I should say. And also to join a panel discussion afterwards is Will Gregory, who is a physio rheumatology lead from Salford, and Dr. Sam Norton, who, well, I'll allow you to introduce yourselves. It might be easy to get your titles absolutely right. So, Will, could you introduce yourself?
Yes, so I'm a physiotherapist and I'm one of the professional advisory board for NRAS, and I've got a 3-month role as interim clinical director for the rheumatology team at Salford Royal, which is good fun looking after those kind of decisions. And of course, I've got a keen interest in exercise as one of the more important ways we can improve the lives of people living with RA.
Thank you, Will. And Sam.
Hi there, Claire. Thank you very much. Yes, my technical title is Reader in Research Methods and Statistics, but that's not very clear about what I actually do. Most of what I do is looking at mental health in people with long-term conditions such as rheumatoid arthritis.
Thank you, Sam.
Thank you.
And Emma.
Hi, I'm Emma Caton, and I am a research assistant. So I've been working with Claire specifically on this Stress Matters project.
Lovely. Thank you very much. And the reason we started this project was anecdotally over the many years I've worked at NRAS. So many times people have said that stress has definitely exacerbated their symptoms, or they can put down why their RA started from a stressful event in their life. And so we kept hearing this and we thought, well, we haven't got any real facts to back this up. And that's what triggered this whole project off. So without further ado, I'm going to hand over to Emma, who's going to share with you some of the real take-home messages out of our Stress Matters survey report. So over to you, Emma.
Okay, thank you, Claire. So these are the results, as Claire said, from the Stress Matters questionnaire and report. So just to give you a little bit of a background of who actually took part in the questionnaire. So we received over 1,200 responses. So those are the people that completed all of the survey. And we also had a section that looked at any final comments where people could just kind of put in whatever it was that they wanted. And we had just under 400 responses from that. So that was really nice in kind of giving a bit of context to some of the statistics that I'll present today. So the majority of participants were female. They were over the age of 55 years old and they were white British. And 46 had had arthritis for over 10 years. So the first few questions really asked about what are the causes of stress and how has that impacted on the onset of inflammatory arthritis. And we found that 76% of respondents felt that their arthritis may have been triggered by stress or a stressful event. And there are many different causes of this, but the main causes were family and work. And this included kind of really significant life events. So, for example, the loss of a loved one or changing your job, but also day-to-day stressors. So things such as taking care of children or elderly relatives, but also like general work pressures and demands. And then there was 81% of people who actually found the diagnosis process for their arthritis stressful. And there were lots of mentions of having to wait a long time, having to see the doctor repeatedly. And over 20% of people felt that their concerns and anxieties were actually dismissed during their initial rheumatology appointment. So following on from the diagnosis of arthritis, we then looked at what is the impact of actually living with arthritis and how stress may influence that. And living with arthritis was actually identified as a cause of stress. There are several reasons for this. So experiencing difficult symptoms, difficulty accessing healthcare support during flares, and perhaps being unable to do things that people were previously able to do, and therefore having to rely on other people to kind of fulfill those tasks. So 77% of people actually felt that their flares are triggered by stress. And these were similar events to what they believed initially triggered their symptoms. So again, work pressures, family pressures. But there also came this idea of it being a vicious cycle. And I think the quote on the screen really illustrates this really well, in that people were experiencing stress, which in turn triggered their flares. And then the flare itself generating stress because they're in pain, because they're unable to do what they want to do. And it's just kind of causing this never-ending cycle of stressing and flaring and stressing and flaring. So moving on to support to manage stress, our findings suggest that rheumatology patients are not routinely asked about their mental health during their rheumatology appointments. So 75% of patients have actually not said they weren't asked about their mental health during their appointments, and 84% felt that their consultant or their nurse actually only focused on the physical symptoms of their condition rather than mental or general well-being. Only 17% of respondents had been offered support to manage their stress, and this support tended to be offered from the GP rather than any other healthcare professional. So 52% of the people who were offered support from their GP. And then the most common types of support that were offered were medication, with 58% said they were offered medication, and then kind of other talking therapies. So this is excluding things like CBT and ACT, which were also regularly given, but these other types of talking therapies, such as counselling and things like that, were also a type of support that was offered to people. So then we looked at the actual stress management techniques that kind of people are doing individually within their day-to-day lives. And as you can see here, the top three were physical exercise, so kind of walking, swimming, going to the gym, walking the dog, meditation and mindfulness, and then also keeping informed about their IA. So lots of people actually, when they gave their comments at the end, mentioned using things such as the resources provided by NRAS to actually keep up to date with kind of the latest news. There was things such as medication, kind of creative outlets such as singing and art, peer support and complementary alternative therapies, which include things like massages, acupuncture, herbal medicine. And for most of these, the people that kind of used these techniques actually did find them really helpful in reducing their stress. So of those people that used physical exercise, 96% found it useful in managing their stress. And those who used peer support, 95% found it useful in managing their stress. So as well as actually engaging in these activities, it was really helpful specifically for stress management as well. So finally then, these are a few other things that people were kind of using as their stress management techniques. So spending time outdoors and exploring nature had a really positive impact. And for those that were able to, making changes to work, so either retiring, changing jobs or reducing hours. And also acceptance was a big thing that came out as well. So 54% of people said that they either greatly or completely had come to terms with their arthritis. And of those, 48% found that acceptance had a really positive impact on their stress levels. So that was kind of a really positive result. And that was a very quick whistle-stop tour of the results. I hope I haven't missed anything too important. But yeah, thank you.
Emma, for that, and welcome back to Will and Sam. One of the things that really struck me there, one of the final slides, and I think people probably watching this will question it to an extent, is acceptance. And what does acceptance really mean? And I remember listening to a presentation once before, and acceptance doesn't mean that you're happy about something, but that you accept that that's the way it, you've got something that you've got to deal with. Is that something that you've come across, Sam, in your dealings with, with people, and how would you explain what that sort of level of acceptance actually means?
Yes, I'm not an expert in kind of acceptance or acceptance and commitment therapy, but that's kind of an important area that people focus on a lot these days. Like you said, acceptance here is not necessarily to do with being happy about your situation, but it's about accepting what your situation is and being able to make appropriate kind of targets for your kind of behavior. So you think about what your outcomes, what you want, how do you adapt your life in a way that you can, if you have rheumatoid arthritis, there's going to be lots of limitations and challenges with that. How do you make sure that your goals that you have in life are kind of achievable within that? That's not to say limiting your goals, but thinking about things slightly differently and maybe being a bit more flexible. So I think acceptance really is a lot to do with how flexible you are about how you approach things.
Indeed. And then we're going through, we were really overwhelmed with the amount of responses that we got, over 1,200 responses, which in itself told us that stress and the topic of stress was really important to people. What were some of the things that really struck you when you were doing the analysis?
I think definitely the large amount of people that actually said that they felt that this was a trigger for their stress, trigger for their arthritis, and kind of in such a varied way as well. There was lots of different comments in relation to work pressure, to family pressure, and that it wasn't just necessarily big events like, getting a divorce or, retirement, that actually there was lots of day-to-day pressures that had kind of built up, that was kind of leading to kind of flares and things like that. And also I think I personally found, coming kind of from a kind of psychology background, I did find it really interesting the amount of I'm trying to think of the right words, put me on the spot, sorry. Kind of the how big things such as physical exercise and these things that you can kind of do day to day, what an impact that actually was having on people's ability to reduce their stress. There was actually a large percentage of people who said, oh, I seek support by myself, but a lot of that can come from physical exercise and from, keeping up to date and things that you can do, not necessarily needing to go and see like a health professional for. There are things that they have done by themselves. And I thought that was really interesting.
Yes, I think that was one of the things that really struck me was, lots of people had actually found their own ways of managing stress. It hadn't been suggested to them, or they weren't really guided to that. It was often, through trial and error. Will, being a physio, of course, you will see lots of people with inflammatory arthritis, and they will have been probably referred to you. But more from a physical point of view, do you feel, or why isn't it discussed more in clinic about how the mental health and the stress could impact on their rheumatoid arthritis?
Well, I think the second part of your question is probably the easy one to dig into, is why isn't it discussed? And partly it's limited time in those appointments, but that shouldn't be the crucial factor necessarily. I think from feedback, when I've spoken to people, sometimes there's a concern as if you ask the person you're seeing in clinic, how you're doing, what your stress levels like, how are you coping? Well, what's the answer going to be? And if the person then breaks down in front of you and it takes 20 minutes to console them, well, you've not necessarily got 20 minutes. So it's a bit like, should you open Pandora's box? Because once you've opened it, how do you then put everything back in a timely fashion? So I think there's partly a concern from a clinician point of view as to how do I ask this question in a way that gives me the ability to support my patient, but not go beyond the confines within that clinical appointment, but also knowing that you can then give an answer. And from a medical practitioner point of view, we're quite keen on saying, or certainly from a physio point of view, if I talk from my core profession, oh, you've got a sore ankle, here's an exercise for your ankle. There's the answer. You've got a problem, here's the answer. Whereas those broader kind of mental health problems where there's not a clear answer by means of I'll send you to this person or we'll give you that tablet, where it's more complex to provide a solution. I think it is difficult to encourage everyone in the team to undertake those conversations when they know it might lead to either a prolonged discussion they don't possibly have time or the best skills for, or lead to a situation where they have to say, I don't know what the answer is. And sometimes that's all that your patient needs to hear, is to say, okay, I can hear you're really struggling. We've got you on the best drugs. We've got you the best treatment, whatever else. It's still not quite hitting. I don't have many other answers. I'm really sorry it's not working quite as perfectly as it should do. And perhaps just accepting that, as kind of Sam just described, sometimes living with a long-term condition, there is an element of accepting that it's not going to be perfect all the time, potentially, although we'd love it to be that way. There's issues that aren't so easy to patch up as rapidly. So I suppose that's the query of why it doesn't get asked, perhaps.
Yeah. And I think there's an element there of perhaps acceptance by the clinician, the nurse, the doctor, or whoever is there at the time, that they don't necessarily have to have all the answers right there at that point in time. And many people say and it came out in the survey as well, didn't it, Emma, that just being listened to or taken seriously or acknowledged in some way. We have a question that's come in, well, not a question, but just a comment on Facebook. Thank you, Anne, for putting this in. I find that rheumatologists believing your symptoms means a lot less stress, being taken seriously. But sometimes it feels like medical professions doesn't believe how bad it possibly could be unless they see it in a CT scan or an X-ray. But the actual way that somebody is feeling is just as important as what is physically being manifested. In your teaching, Sam, is this part of what you're trying to get across to medical students, etc., about that psychology is just as much as relevant as the physiology of these sorts of long-term conditions?
Oh yeah, absolutely. I wasn't at all surprised when I saw some of the results, and it said that only 25% of people felt that they'd been asked about stress during their consultations. It's a huge number of people that aren't, and it's something that I wouldn't say it's necessarily ignored, but it's something that's left as a slightly lower priority. I think when people see their rheumatologist, most people have very good rheumatologists that will be very interested in their health and their physical functioning. And we're really interested in looking at blood tests to check what their inflammation levels are and making sure that they're on the right treatment to reduce their inflammation and halt the kind of disease progression. That's obviously going to have real long-term impacts. But it's sometimes the here and now that I think obviously don't get talked about. And as Will was saying, sometimes it's just that little chat to check someone's okay. I think it's also important really to focus on, thinking at different levels. Some people may be really struggling and may need urgent supports. And I would hope that most of those people get, talked about because it's either relatively obvious to the clinician or the person feels confident enough to bring it up in that session. We all know how hard it is to see a GP at the moment. I've struggled with that myself recently. So sometimes speaking to your rheumatologist might be the key person to talk to about that. It's important to recognise that if you have problems with stress and your mental health, it's not just your GP that can refer you on. So if they ask, if you have a problem, you can talk to your rheumatologist, and they can refer you on to talking therapy services. You can even go and self-refer. So if it's something that isn't being discussed within the rheumatology appointments, because sometimes there's limited time, or if things are being delivered remotely, it can be a problem. There's lots of things going on though that I think we're trying to improve the situation. I think everyone recognizes that there's limited amount of time within a clinical appointment to talk about things, and that some things get prioritized, so there's less time. But that can never be an excuse for not talking about stress and mental health. I think a lot of centres now, particularly where the ones that I work with at King's College Hospital and at Guy's and St Thomas's, they've got some really nice systems now where they send people before their appointments a short survey where they can give some ratings about not just their physical health, but also their mental health. So it gives the the clinician an opportunity to be able to look at that and see, does it look like I need to have a conversation? It just allows them to be able to prioritize what they talk about. And if, you know, symptoms like pain and fatigue are really high, that's obviously something to talk about. But also if it looks like someone's struggling with their mental health, there's an opportunity there, I think, to approach things slightly differently, and think in the limited time that people have within the appointments, how can we frame that conversation? I know NRAS has been doing some really good work as well with clinicians, talking about how they can approach difficult kind of conversations and topics, and about certain things that maybe get missed.
Indeed. And actually you hit on something there. Of course, with the advent of more patient-initiated follow-ups for people with long-term conditions that are, you know, physically they are well managed, their disease is reasonably well controlled, and they might be put on to patient-initiated follow-up pathways. They might be called something different in different places. So this remote monitoring, or do you feel it will be beneficial in some ways, because those questionnaires will be sent out and completed and sent back? Or will it be that these sort of other areas of the impact of a long-term condition could be missed? Who wants to go for answering that? I think I'll come to you, Will, because I saw you nodding there.
Yeah, I mean, I think that's the hope, and Sam described it very well, the way that we are having these opportunities to send out questionnaires or surveys to get data ahead of that appointment. But it could also be, if you are on that patient-initiated follow-up pathway, you're sent those every 3 months or something. So there's a lot more data that we're given outside of that squeezed 20-minute follow-up. So I'm hopeful that it's the first one that you said, that will allow more time for those kind of conversations. And perhaps if you have that data already submitted when you get to your appointment, your rheumatologist will be able to say, okay, I can see your numbers for the last 3 months. They show this, this, and this. I'm very happy. Your drugs are working. What else do you want to talk about? You know, because all of the business end of the numbers and figures and so on will have been done kind of outside of that limited appointment time. But yes, it does mean if people aren't so good on inputting data and sending their forms electronically, or however it's done outside of those appointments, those people might then struggle to be heard. The other bit with the patient-initiated follow-up is the hope that that means we have more secretarial support or admin support, so there's people to answer the phone, because one of the big stresses, I think, is contacting your rheumatology department when there's not enough people answering the phones. So if patient-initiated follow-up means there's a discrete phone line for that, hopefully that stress of being 64th in the queue will be a thing of the past.
Oh, I like your optimism there, Will. Let's live in hope. I will glass half full, definitely there. Emma, what else was it that you thought really jumped out at you from the report when you were doing the analysis of over 1,200 responses was quite a marathon task. So thank you, first of all, so much for doing that. But what were some of the other nuances that you noticed in the full report? And by the way, anybody watching, you can get a copy of the full report. You can download it from our website if you want to see it in full. Sorry.
Oh, no, sorry, just to add to kind of what Will was saying as well. When I was kind of did a couple of interviews, one-to-one interviews with people as well, and looking at the comments, I think a lot of people felt a little bit like they didn't want to bother anybody by picking up the phone and speaking to their rheumatologist or their GP. And there was an idea of, you know, well, what if the service is already overwhelmed and I don't want to be a bother? And so I think it's kind of also really important. That's what they're there for. That is what your doctors and nurses are there for, is to kind of listen and to explore these kind of other aspects besides physical health as well. And so it's difficult, but to not feel like you're burdening anybody, because if it's an issue to you, it's an issue to you. And I think that is definitely something that perhaps needs to be, you know, explained more, kind of, that, you know, it is okay to kind of, you know, kind of have those discussions in the first place, even if it's not necessarily the rheumatologist or the GP that is kind of initiating those conversations.
Absolutely. It's okay not to be okay. It's basically what we're saying, you know, that it's And of course, what was clear as well is that when getting stress or over issues around work or, some other stressful activity or friends or family causing stress on, and there was some really, really heartbreaking free text that we were able to see as well, and people were having really tough time, that not managing that stress can of course lead to a physical outcome as well. And it is that, what you showed in that slide, the vicious circle, that the more stressed you are, then your joints hurt more, you've got, you're not sleeping well, that exacerbates things, and then you might have a massive flare, as opposed to getting it under control early on. And it is a bit like early diagnosis of any condition. If you get to it quickly enough, you can probably manage the outcomes further down along the line. But it's hard to measure stress, and I call, we all have stress in our lives, but when do you know when to reach out for help, and when you can, sometimes muddle on? And I think that's what you were saying. There's so much stoicism that people are, incredibly like British about these things, I suppose, that, well, I don't want to be a bother, I can cope, everybody else copes, so why can't I cope? And of course that's a difficult one to crack, really. Sam, what advice might you have for people who might be thinking, I could do with help, but is it at that level that I need help, I suppose?
Yeah, I think it's really important to think about, and think about those levels are important. I think sometimes, people have very severe levels of depression and anxiety where it's, psychiatric levels of disorder, and they may need to see a psychiatrist or someone to talk to about their condition and get some therapy that way. But I think most people will be living with, what we refer to as disease-related distress. It's those stresses from having the rheumatoid arthritis or something like that that really impact on your day-to-day functioning, where you may not have depression and anxiety, but it's still impacting on your mental health. And it's those bits are very hard to deal with. There's not, within the NHS, there's really not anything you can do. NRAS obviously has lots of support. You've got your kind of online interventions, and there's the NRAS helpline to phone up for advice, because that's where you're left a little bit by yourself and with your friends and family to almost muddle through. And I think while we tend to be a bit stoic, it's good just to make sure we're talking about those things, not just to your rheumatologist or the physiotherapist or the nurse that you have contact with, but to people like NRAS and your friends and family as well. There's nearly always something that can be done, and I think social support in particular is a really good way to buffer that impact of stress on your kind of mental and physical health. It's really thinking about what support can I get from other people around me. That could be friends and family, or support groups like NRAS. There's a huge range of things that can be done.
Reaching out to support, reaching out to support is not, it's not weakness. It's not that you failed. It actually shows great strength. And certainly I see the way that peer support is helping people through we have an online community called Health Unlocked, and it doesn't seem to matter what time of the day or night somebody is feeling low or and they might post there, and there'll be somebody else who is there going, you're okay, you're not alone. And I think it's just that feeling, reducing that feeling of isolation in itself can make people feel a lot better. And the peer support came out, quite strong, that those who had that peer support, be it through going to a local group or talking to somebody, a volunteer in our Here For You service, etc., or on Facebook or wherever, that peer support, was it something like 95% found the peer support was helpful? Was that surprising, Emma?
Yeah, so it was 96% of people who accessed peer support found it useful, and I think that it wasn't surprising in that I think being able to share experiences, even if there's not a solution to anything, can be really, really helpful, and to kind of understand that other people are going through the same thing, and to get kind of hints and tips off of people. I was speaking to somebody who said, I struggle to dry myself when I get out of the shower, and somebody else saying, oh, well, I use a hairdryer, and do you know what I mean? Just being able to share little tips like that, you know, you won't necessarily get from anywhere else. You know, it's people that have kind of been through a similar thing and can kind of advise on certain things. And yeah, it definitely came out strongly in kind of the results and in what people were saying. And I think it is a really valuable thing. I think just kind of having that kind of promoted a bit more within perhaps the healthcare services. I think it was 21% of people had taken up peer support. And I think it is a really valuable thing. And perhaps that is something that patients could kind of be made aware of a bit more kind of when they're attending their healthcare appointments.
Yeah. That's sort of been there, done that, got the T-shirt, know what you're going through. You don't have to do that explanation about what it's like to live with RA. That is vitally important. And I can sort of see one of our lovely volunteers is on the chat, Teresa, who runs one of our local groups in Hertfordshire. And that, you know, it goes from strength to strength because of that networking, and that you're right, sharing those everyday tips and techniques. And I think the other thing that really struck me out of the report is when we asked people what had they found that really worked for them. And I'm sure Will was delighted to see that exercise was the top thing. But exercise kind of frightens the pants off some people, going, well, I might hurt myself more, or my joints might ache, etc. But of course, you know, we've done one of these NRAS lives once before with Will, and showing the link between physical and mental health is so important. But what would you say to anybody, Will, who is perhaps a bit nervous about trying exercise as a way of coping with their physical symptoms, but also their stress level?
The word I use most commonly in clinic at the moment is Goldilocks. So we want to do not too much exercise that it ends up aggravating your symptoms or making things worse, but not too little exercise, but just that optimum amount in the middle. So it was really interesting reading this paper. It talks about how, you know, stress can throw off our hypothalamus pituitary adrenal system. And I read that and thought, oh yeah, that gets activated when you exercise. So having a little bit of that is a good thing. So exercise is good at decreasing stress through that same kind of pathway, but it just needs to be just about the right amount. And that's what's really difficult, is some people will have been highly active before they got their arthritis, and then somewhat limited and very frustrated, and they'll want to go out and still climb mountains. And many people with RA do climb mountains, but if you're unfortunate and you don't have that capability at this stage in your disease control, it's how you cope with the fact that you can't do as much as you wanted to do. Your Goldilocks trying to eat that massive bowl of porridge, or the too hot bowl of porridge, I think it is, isn't it, in the story. So this analogy might be going a bit too far, but and then there's other people, like you say, who are petrified of exercising because they've not been able to, and they're concerned of what it might do to their joints. We know that exercise helps joints if it's that right level for you, and helps the disease process generally. So I think it is really pleasing that it's come back from this survey. You know, nearly 2 in 3 people said exercise was a help for their stress levels. So that's fabulous that that's the lived experience of 700 people, 800 people who answered the survey. So it's not just a textbook answer. This is what's happening up and down the UK. And I must plug at this point the NRAS Smile RA resource, because the importance of exercise module that we've recently recorded is a fabulous resource. And there's Professor Metzios, George Metzios, who's far more intelligent than me and knows far more about this than me, who's speaking beautifully on that session, as well as some taster videos to try different forms of exercise that we think people might be able to build into their daily routine to kind of hit that optimum level, not too hot, not too cold with the porridge, or whatever it may be for your analogy.
And I think it's you know, finding what works for you. RA is not a one size fits all condition, and nor is the solutions to dealing with it. So I'll just reiterate that. So nras.org.uk /smile, can't get my teeth in, gives you access to all these free modules, but the one on exercise in particular, as I said, there are, as Will said, there's little taster sessions there, sort of 10-15 minutes. You could try chair yoga, or you could try Tai Chi, or you can see there's moving to music. So it's working out what will work best for you, and trying it out and not being afraid to give it a bit of a go. It doesn't all have to be in some flashy gym on a treadmill with all the gear and the lycra and the sweatbands and lifting weights. It's what works for you. And trying those little taster sessions have really proved to be very beneficial for a lot of people. So I'd encourage you to all to take a look at that if you can. Somebody has mentioned in the chat as well about mindfulness, and Sam and Emma, you know, mindfulness, it kind of was all the rage for a little while. It's kind of gone a bit quiet now, that, you know, so again, is it a not a one size fits all? It works for some and it doesn't for others. I personally don't know an awful lot. I haven't practiced mindfulness, but you know, what sort of comments would you have for people who are thinking of trying it, but are perhaps a little nervous? I'll come to you first, Sam.
Okay, thank you. Yes, I guess there's lots of different techniques, like exercise may work. Mindfulness is something people may want to try as well. And it's really developing a range of different techniques. It's a bit like the kind of the analogy of the different bowls of porridge. And you can have mindfulness and go very deep into it, and that may be a bit too much. But there's lots of things that I think are really helpful with stress. One that I find particularly useful, and with students I use quite a lot before exams, of just doing something like a body scan. So mindfulness there is really to help you step back a little bit from your emotions and be a bit present in the current moment. And something like a body scan where you focus on your breathing and the sensations in your body is just a good way of, when you're feeling overwhelmed by stress or whatever else is going on, is just taking that little bit of a step back and allowing yourself to kind of breathe and just take a little bit of a break. So that kind of low level approach there can be really useful. So I think a lot of people try mindfulness and find it can be a bit too much to get deep into it, and don't go into kind of retreats. But there's lots of different ways to do it. And I think a nice thing to think about as well, if you're combining the mindfulness and exercise, is things like yoga and stuff like that. That's very easy to do at home. I do a little bit of yoga and I do it really badly. It's definitely not about doing it well at all. It's just trying to build those into your daily routine and activities, isn't it? And having that way of centering yourself with exercise and centering your thoughts, and just trying to not let the stress kind of overwhelm you at times. It's good ways to have coping mechanisms like that.
Yeah. And there were some lovely comments, weren't there, Emma, about other things that people had found, like singing and meditation, and it is just, you know, trying to find the right thing that works for different people.
Yeah, absolutely. And I think just, you know, having hobbies, I think was quite a key thing that came out. Even, you know, gardening and, as you said, you know, arts and crafts and all sorts. And I think it kind of comes into that self-care and self-compassion kind of sphere of things, of kind of making time for yourself, and, you know, life getting very hectic and having lots to do, and putting aside time that is just for you to do something that you enjoy doing, and kind of allow your mind to kind of go somewhere else, whether it's because you're, you know, repotting a plant, or, you know, whatever it is that you're doing, to just kind of, I think, you know, my personal experience getting into the garden, thanks to my dad, just coming kind of back into the present, rather than thinking about the emails and the washing up and everything else that I'm supposed to be doing. So yeah, I think having hobbies and taking time for yourself can be really helpful as well.
And I suppose it's you know, probably lots of people feel this way, that, you know, taking that time out to do something that brings you joy and brings you that sort of peacefulness, you know, we can often feel quite selfish about it. But actually, self-care is not selfish at all. It's that analogy of, you know, make sure you put your own oxygen mask on when it goes on the aeroplane before you help somebody else, because you're no good to anybody if you just stretch yourself in all directions and then it all comes untangled. So self-care shouldn't be something that you feel guilty about, going off to a singing lesson or going for a walk in nature when, as you say, the laundry basket is overflowing, whatever, that will be there tomorrow as well. That's what my excuse is for not doing the laundry anyway. But it's been really, really, I think anybody that's out there watching this, if you took part in our survey, I really want to say a sincere thank you, because now we have a body of work that perhaps future researchers will be able to delve deeper into and actually take stress and the importance of asking those questions in a clinic appointment and thinking about the whole person, not just that swollen knee, which at the time, of course, needs addressing, but there's a body attached to that swollen knee or that painful elbow or that painful shoulder. So thank you very much indeed. One of the things, a question that was put forward before this evening was about, there are still an awful lot of people very stressed over COVID. And for many people who haven't mounted a good enough response to the vaccines, many are still shielding. And I really, believe me, you have not been forgotten. We are doing an awful lot of work behind the scenes, NRAS, along with other patient organisations. And there's a big study a clinical trial going on at the moment to try and see if a pre-exposure treatment for those that haven't been able to mount a good response to the vaccines can be found. We have had reassurances from NICE that if something was proven to be good in clinical trials and get licensed, that it would be fast-tracked so that we can get that out as soon as possible. That doesn't help you in this moment in time if you are one of those people that are still shielding and worried and concerned about going out in public or in public places, crowded places. But I just wanted to say and comment on that you are not forgotten. And we are still working hard along with many other scientists and patient organisations that are affected. So thank you, whoever did put that comment in. I just wanted to say that. So our time is up. It flew by. Thank you very much, Sam, Will and Emma, for giving up your time after, I'm sure, what has been a very busy day. I know Sam just came straight from teaching to join us this evening. Our next NRAS Live is actually not, I repeat, not on the last Wednesday of every month as it normally is. We've had to move it just to accommodate the people who will be able to be on our panel. And it's about men. It's about men and rheumatoid arthritis, just for you chaps out there, because we realise that, often what we talk about, there's a lot of women involved in these conversations. So there won't be a woman in sight. And we're going to call it the men's room. So please do join in the men's room on the 14th of November at 7 o'clock. And my colleagues Stuart and Tim will be hosting that with an excellent panel. So that will be the last one for this year. We won't be doing one in December because it falls around the Christmas period. And we're open to suggestions. What sort of topics would you like us to address? What sort of people might we have on our panels for next year? We will continue them every month. The last Wednesday of every month, we will be doing NRAS Live. So please do let us know what sort of topics you might like us to cover. Some of the ones that are being muted at the moment are oral health, dentistry, etc., and looking after your gums, and sometimes how that can be an early indicator of inflammatory disease is your dentist might pick that up. Surgery, lots of other topics that are being put forward. So do let us know what you want us to hear, and we will do our best to do that. The other things, any of our NRAS Lives that we've done this year, they're still all available. So if you missed one from back in February or March, they're all available on our YouTube channel. So do go on there. There's some of the topics we've covered so far is remote monitoring, what that will be like in the future. Exercises, of course, Will, you joined us on that one way back in the spring. Research, how you can get involved in research, what sort of research is going on. Pregnancy and RA, foot health and orthotics. We are really trying to cover as many of the topics that are important to you, our beneficiaries. So please do check those out. And lastly, I want to say I won't be joining in the men's room in November. So this will be my last NRAS Live for this year. I'll be back next year with, again, hopefully a lovely panel of people to speak to. But I just wanted to say it's never too early to get your NRAS Christmas cards. So we have got them available. So there, my colleague has just put up the link. Please do. It's a great way to support your charity, your patient organisation, and those funds will go, of course, to making sure that we're able to do as much as we can to improve the lives of all those living with RA and JIA. So thank you very much. Yes, I've seen somebody, will this be recorded? Yes, it has been recorded, Jane, and it will be on our YouTube channel to watch back from the beginning. As have all our NRAS Live broadcasts, so you can find them there. Thank you so much, Will, Sam, Emma, for joining me this evening. And it's now time probably to put your feet up and have a nice glass of wine. Medicinal purposes only, of course. Thank you very much indeed. Good night.